Look around you, the people sitting next to you, the ones you came with, the ones you pass every day. At some point, one of them will face something that doesn't quite make sense. A diagnosis that explains part of it, symptoms that don't quite connect, a sense that something deeper is being missed. More and more people are finding themselves there, living with chronic illness, navigating complex conditions, searching for answers that bring clarity. And when those answers don't come, the question stays. Long before it became a clinic, that question lived in one person. In Wichita, Kansas in the early 1970s, Olive W. Garvey paid attention in a way that stood out. She kept asking questions, following ideas even when they weren't widely accepted.
Grandmother had an expansive mind, insatiable curiosity. She would accept almost all new thoughts and ideas until they were refuted or disputed.
I feel that the potential of this facility is limitless, but the realization of that potential is dependent upon the amount of financial support it can attract. Those of us who have provided these buildings feel a great sense of satisfaction with the results which we have achieved. The betterment of life for those now living is a tremendous achievement. But present treatment is for the now. Research is for the future, for the ages. The dream of the Center for the Improvement of Human Functioning is to become not only a landmark for Mid-America, but a benchmark for the human race.
She followed that curiosity all the way down to the foundation.
She knew that nutrition began at the ground level, in the soil, with the plants. She thought it important to keep what we ate and what we ingested healthy.
That way of thinking needed somewhere to take shape. That's where Dr. Hugh Reardon came into the picture.
When Mrs. Garvey had asked him to write a proposal about funding, and he said that he just wrote basically on a piece of paper, I don't know what I'll do and you don't know what I'll do, but we'll give the next 3 years to doing it. And so she agreed to it.
We're here kind of as a detective operation, and for those people who have not done well in the system, in their standard system, it's very important to discover how their biochemical individuality is different. Our definition of health at the center, for instance, is that health is having the reserve to do what you need to do and want to do with energy and enthusiasm. And the key word there is reserve. And it is our premise that people get sick after their reserves have been down, usually for a prolonged period of time.
That perspective shaped everything that came after. Those who worked with him and experienced his care described a consistent approach.
He was all about patient as co-learner.
He would take care of the whole patient, and by spending time with somebody and listening to their story.
He basically was he was like a detective, very astute observer.
He approached medicine with curiosity. He paid attention. He stayed with things long enough to understand them and never lost sight of the person in front of him. Together, Olive W. Garvey and Dr. Reardon created something that didn't exist at the time.
When I first came, I was here like the 3rd year after it started. And it was like, I can have you a job for a year. I'm not going to promise anything after that. So we didn't know. We didn't have a blueprint for what we were going to be doing or what the center was going to be doing. And it kind of grew.
A place where nutrition, biochemistry, and patient care were part of the same conversation. A place where questions were explored.
Exploring possibilities. That's the key to all this.
That idea became the foundation. From the beginning, it moved beyond questions into research.
During the period of the RECNAC project, the growth of the awareness that nutrients have the capacity to prevent cancer is literally astounding. This change in awareness, which was decades overdue, is right on target. The concept that nutrients play a significant role in the prevention and possibility of the elimination of cancer is right on target, because throughout nature, in both the vegetable and animal kingdoms, with very rare exceptions, the only time cells change their behavior is when they run out of nutrients. And of course, we all know that cancer cells are cells that have changed their behavior. These facts have formed the basis of much of our research.
Into deep exploration, into understanding more about what's happening inside the body and what's possible moving forward. That foundation didn't stop with its founders. It continued through the people who stepped into it and carried it forward. Dr. Ron Honeyhockey found his way to the Riordan Clinic at a point where something felt off for him.
This is what I wanted to learn in medical school. But I had gone to medical school thinking and reading a lot about wellness and thinking, okay, I'll get that in medical school. Didn't get that. But I was just burning out. I was tired.
He was looking for a fuller understanding, how the body works, how everything connects.
So why don't you come for lunch? So here I am now, because I went to lunch and he offered me a position, and there was a whole transition process.
That learning didn't stop there. It continued into rooms where ideas were shared, questions were welcomed, and a different way of thinking was passed on. Working alongside Dr. Reardon, he made that philosophy something he could live by and carry forward.
And he's always been, he likes to learn, and he likes to impart knowledge to different people. And I think as a doctor, it's not so much as you do this or you do that. It's always he's got something for them to study or learn more about.
Each of us is so individually unique. So you could have 10 cases with the same diagnosis, but 10 completely different physiologies and sets of biochemistries.
The focus stayed on the individual. Over time, that approach became something you could feel. It shows up in how a time is given, how questions are asked, and how closely someone listens.
That's my big number one job, is looking for someone who actually listens.
That kind of attention changes the experience. It creates space to notice more, to notice details that might otherwise be overlooked, to stay with something long enough to understand what's really happening.
And they're coming here hoping that we'll look at it from a different perspective and give them something that they can get a hold of and work.
And over time, that experience stays with people.
It's a long process.
It was a long process.
It was very easy, every little thing that I had, it was so easy to say, oh, well, that's normal, everyone goes through that. And no one was willing to look at the whole picture.
For a while, that becomes the pattern people fall into. You adjust, you keep going, you try to make sense of it. Until someone tells you there's more to understand. For others, that moment comes differently, but it carries the same weight.
When you're diagnosed with breast cancer, you are nervous. You have so many decisions to make, so many things to figure out.
That moment changes people. It slows everything down. It raises new questions. What's really going on? What are we not seeing yet? What if we look deeper? For the people who come here, the experience is personal.
We're not here to treat a spot. We're going to treat the entire Jenny. I really do believe that you have to be comfortable in your healing home, wherever your healing home is. And so for me, it's been Riordan this whole time. To walk in and have people know me by my first name, to be able to call, to be able to email and be on the patient portal, whatever it is, that's made a tremendous difference.
Being known changes things. It changes how you feel. It changes how you engage.
And I remember her looking at me and she said, Kellyanne, this is 100% cancer and it needs to come out soon. And the next day in my email was like a 20-page treatment plan that was like completely individualized. The whole treatment plan addressed my whole being. And as a healthcare provider myself, I just was like, wow, every cancer patient deserves this type of care.
but I've never met a group of people who were so wonderful and so loving.
That feeling shows up in different ways.
I feel very supported. I feel like everyone knows my name, and that makes me feel important.
It reflects a different kind of relationship between patient and provider.
The patients, or Dr. Ron called them co-learners, and some of them were, but some of them came in hurting and wanting to be healed, and I think they found something here that they didn't find at other places.
One where people are part of the process. The work has continued for 50 years. It's been carried forward by people committed to continuing the questions that started it.
Grandmother would be so thrilled and so happy to see that the center has been sustained and carried on. He has carried on and pursued this relentlessly.
And that spirit is still there.
Exploring possibilities, that's the key to all this.
And over time, the work expanded beyond the clinic itself.
They're still looking for answers.
And they will be. Because it continues in the people around us. The ones we know, the ones we love, and in the people carrying the work forward. Building on what comes before, asking new questions, continuing the search. Each person brings their own story, their own questions, their own path forward.
This is a place, if we were to follow Grandmother Garvey and Dr. Reardon's vision, it's giving you permission to live a long, healthy, and fulfilling life.
50 years later, that commitment is still there. There's still more to understand. Keep asking, keep learning, keep looking deeper. Thank you to those who continue this work each day. The staff, the volunteers, the co-learners, and those who support it. This work continues in a way we may never fully see. Thank you for being a part of that ripple.